Hello guys. So now we shall be discussing regarding the basal ganglia. Okay. There are different kinds of nuclei, right, within this basal ganglia. So first of all, we shall discuss what is this basal ganglia, and later on, what is the use of this nuclei, what are the connections of basal ganglia, what is its function, we will discuss it. Okay. So topic of discussion would be regarding the basal ganglia. Now, coming to this basal ganglia, two important things we have to discuss. First of all, we will discuss what is called as nucleus, and we'll also discuss what is called as ganglion. Okay. So first of all, we'll discuss what is called as nucleus. Second is what is called as ganglion. Now, by the way, what is nucleus, guys? Nucleus is nothing but called as collection of neurons. Okay. Or you can also tell nucleus is nothing but masses of gray matter which is located within the white matter of central nervous system. Okay. So that is what is called as your nucleus. So for example, if you take this as a cerebral cortex, this as your cerebral cortex. Okay. Within the cerebral cortex, if you very clearly see the outer, this yellow color thing, whichever I'm putting over here, right? So this is your cerebral cortex. Now this cortex is having a matter called as gray matter, and the center, what is the color? It is white. So this is called as white matter. Outer will be the gray matter, inner will be the white matter. Now within the white matter also, you see there are some yellow color dots which I'm drawing, right? What are these yellow color dots? These yellow color dots are nothing but your gray matter. So there are some pieces of gray matter, small pieces of gray matter, or small areas or masses of gray matter that are distributed within the white matter. So these masses are nothing but called as your nucleus. Okay. So let us write it down. Nucleus is nothing but collection of neurons or masses of gray matter within the white matter. Within the white matter of your central nervous system. So this is what is called as nucleus. Then what do you mean by ganglion? Ganglion is also has got the same definition, but there is only one difference. Now this entire thing is located within the central nervous system, but when it comes to ganglion, it is located outside the central nervous system. Okay. So it is also has got the same definition: collection of neurons or masses of gray matter. Okay, masses of gray matter outside the central nervous system. Outside the central nervous system is called as ganglion. For example, what is one example of the ganglion which you can give? That is your spinal ganglion. Spinal ganglion. What is the other name for spinal ganglion? Spinal ganglion is also called as DRG, dorsal root ganglion. Okay. So if you look at the spinal cord in this way, let us say this is your spinal cord, right? And here so within the spinal cord here you have got a dorsal root, right? You have got a ventral root. Now dorsal root has a ganglion like this, right? This is called as a dorsal root ganglion, and ventral side there is no ganglion. So together they will join and form a spinal nerve like this. Now this particular part which you can see, this is what is called as your spinal ganglion. Okay, or you can also call it as a dorsal root ganglion. Right. Next important thing is that let us see what are the different kinds of nuclei that are located within this basal ganglia. There are many different types how you can classify this basal ganglia. Now we will discuss one by one. So let us discuss the basal ganglia classification type 1. So first way how you can classify this basal ganglia is that this particular basal ganglia, this later on I will draw all these structures. Okay. So just now write it down. This particular basal ganglia, okay, is divided, this particular basal ganglia is divided into 4 important things. 1, 2, 3 as well as 4. It is divided into 4 important things. What are these 4 important things? The first one is called as corpus striatum. First one is called as your corpus striatum. Second one is called as your claustrum. Second one is called as claustrum. Third one is called as substantia nigra. Fourth one is called as your subthalamus. Now, so these are the 4 important things. First one you call it as a corpus striatum. Second one you call it as a claustrum. Third one is called as substantia nigra, and the fourth important thing is called as your subthalamus. So this is how the basal ganglia is divided into 4 important parts. Now, after this, another important thing is that this particular corpus striatum, whatever you can see, this corpus striatum is in turn divided into 2 important things. What are those 2 important things? One is called as lentiform nucleus, which is lens shape. One is called as lentiform nucleus. Another one is called as caudate nucleus. One is called as your lentiform nucleus, and the other one is called as your caudate nucleus. Okay. Now, when it comes to lentiform nucleus is again divided into 2 more important structures. One is called as putamen. Outside you have got putamen, inner you have got globus pallidus. I will draw these things, don't worry. So, one is called as putamen. Another one is called as globus pallidus. Globus pallidus. Okay. So, outer what do you have? Outer side you have got what is this called as putamen, and next you have got is a globus pallidus. Now, when it comes to globus pallidus also, globus pallidus is again divided into 2 important things. What are those 2 important things? One is called as globus pallidus externus. Another one is called as globus pallidus internus. One is called as globus pallidus externus. Another one is called as globus pallidus internus. Okay, so this is the final. So globus pallidus externus we have got, and next important thing is globus pallidus internus. So let us just once again look at what are the structures we have discussed. First important structure we have discussed over here is your what? Is your corpus striatum. Okay, so this is your corpus striatum. Another one is claustrum. Next you have got substantia nigra. Where is substantia nigra located? Substantia nigra is located within your midbrain. Next you have got subthalamus. So I will show you the first 3 important things in a single picture. But when it comes to subthalamus, I have to draw another picture and show you where is this subthalamus located. For example, this is your thalamus. Okay. And where is the thalamus? Thalamus is towards your midbrain. Let us say this is your midbrain like this. This is your midbrain. And obviously this part is your pons. And here you have got your medulla oblongata like this. Now, if you look at the picture over here, if you look at the picture like this, so here you have got one structure like this, you have got another structure in this way. Now, this part in the center over here is called as your thalamus. This is called as your thalamus. Now, beneath your thalamus, you see this area which I am highlighting like this. So, this area whichever I am highlighting which is located beneath the thalamus, this area is called as subthalamic region. This area is called as subthalamic region. Why it is called as subthalamic region? One is it is located beneath the thalamus. Second important thing is this subthalamic region is having nuclei, and these nuclei are called as subthalamic nuclei. So one subthalamic nuclei we have got on the right side and another subthalamic nuclei we have got on the left side. Okay. So this is what is called as your subthalamus. Clear? Right. So you already know now what is subthalamus. Now, next important thing we have to see here is that we even have discussed this important thing that it is having two important nuclei. One is called as lentiform nuclei, another one is called as caudate nuclei. And within this, the lentiform nuclei is divided into putamen, another one is called as your globus pallidus. And again, the globus pallidus is divided into globus pallidus externus and globus pallidus internus. Now what we shall do is that we shall look at all these structures. Now where are these structures located? First of all, just look at this picture over here and you will clearly understand where these structures are located. This is your cerebral cortex. And this line which I am drawing right now, this line is called as a lateral sulcus. Now what I will do is that I will make a section through this lateral sulcus like this. And after making a section, I will look from the lower part and then I can very clearly see all these structures. Okay. So when I make a section through the lateral sulcus, this is how it looks. Right. So this is a structure which you can see. And where is the lateral sulcus over here? You see this sulcus over here is called as your lateral sulcus. Okay. You see what is this line over here? This line is lateral sulcus, but exactly speaking, this line is the posterior ramus of lateral sulcus. Posterior ramus of your lateral sulcus. This is your posterior ramus of your lateral sulcus. So exactly here you can see the posterior ramus of the lateral sulcus. Lateral sulcus. And this particular part which you can see over here, this is called as insula. This particular structure over here is called as insula. Now, let us discuss all these structures. Now, first important thing which we have to discuss over here is that these nuclei, where is this lentiform nucleus, where is this caudate nucleus? So, first important thing is that just follow the pictures whatever I'm drawing here. The first important thing is, so exactly in the center over here, you see this structure which I'm drawing right now, right? So this structure is present on both the sides like this. Both the sides it is present. So, but I'll just draw it only on one side. So this particular structure which is lens shaped is called as lentiform nucleus. And what is the thing over here? We discussed that lentiform nucleus is of two types. One is putamen. It is divided into putamen as well as globus pallidus, right? So all of you look here. Lentiform nucleus is divided into two parts like this. Okay. So this part which you can see, right? So this particular part which you can see right now, see this one. See this particular part which you can see right now, which I'm highlighting here, this part is called as putamen. And the next part here, next part over here is called as your globus pallidus. Now within this globus pallidus also, you divide this globus pallidus into two parts. So the part which is outside, it means this dotted thing, whatever I'm drawing here, this is globus pallidus externus and the remaining one is called as globus pallidus internus. So let me just name these parts. So this part over here is called as, this part over here is called as your putamen. After this putamen, this part over here is called as your globus pallidus externus. Okay. And this one over here is called as your globus pallidus internus. Internus. So together what do you call? You call it as a lentiform nucleus. Lentiform nucleus. So which is having two important structures, putamen and globus pallidus. And globus pallidus has got externus and internus. So this is the thing which you know. Second important thing which you can see over here is that here you have got one more structure like this, right? So this structure which you can see over here, this particular structure is what is called as your claustrum, right? So let us go back to the classification here. So here we have discussed corpus striatum, lentiform nucleus and caudate nucleus. Caudate nucleus I will draw, but right now what do you have is claustrum. So this blue color one, whatever I have drawn over here is nothing but called as your claustrum. So this is your claustrum. This is your claustrum. Now, two more important structures. What are these two most important structures? So let me rub this out so that it would be clear, right? So all of you just look at these structures over here. So first important structure is that, see here the structure which I'm drawing here, this is called as your caudate nucleus. And after the caudate nucleus, down here, whatever I'm drawing here, this part is called as your thalamus. So one is your caudate nucleus, another one is your thalamus. Now between the caudate nucleus and thalamus, can you see one structure in the form of a L shape like this? Right? You see this is present. beneath the caudate nucleus, and here down it is present above your, what is this? This is also called as your thalamus, right? So this part over here is called as your thalamus. See, this is called as your thalamus. So this part over here is called as your caudate nucleus. This is called as your caudate nucleus, and this part over here is called as your thalamus. So this is your thalamus. Now between the thalamus as between the caudate nucleus, you see a structure that is in the form of an L-shaped structure like this, right? So this was a structure, right? So this structure which I have drawn here, right? So this structure which I have mentioned over here, this is what is called as your internal capsule. Okay, so this structure over here is called as your internal capsule. Internal capsule. Internal capsule. Now this internal capsule is having three parts. So this part which you can see here, this is called as an anterior limb of internal capsule, and this part over here is called as a posterior limb of internal capsule, and this center part over here is called as the genu of the internal capsule. So what are the three parts? Anterior part, posterior part, and genu of the internal capsule. Okay, now look at this. Where is the anterior part? So this exactly, this part which I'm highlighting is the anterior part. Anterior part, can I tell anterior part is located in between lentiform nucleus as well as the caudate nucleus. Second important thing, posterior part. Where is the posterior part? So can I tell posterior part is located in between the thalamus as well as the lentiform nucleus? Yes. After that, you have got this important part which is present here. You have got this important structure which is present here, that is present between the claustrum as well as the lentiform nucleus. Now this structure over here, you call it as external capsule. So one you have got is the internal capsule, and this one over here is called as your external capsule. External capsule. And this one over here is called as your internal capsule. Internal capsule. So the same things whatever I have written here is also present on this particular side. So these are the structures of what? These are the structures which you need to remember regarding this basal ganglia. So what are the structures we have discussed? We discussed corpus striatum. Where is corpus striatum? Lentiform nucleus and caudate nucleus together is called corpus striatum. It means, see, this red one is your lentiform nucleus, and caudate nucleus on the top. These two together are called as a These two together is called as your corpus striatum. And within the lentiform nucleus, you have got two important structures. The outer one is called as a putamen, right? So let me now put this part. You see, this part is called as a putamen, and after that, this part is called as a globus pallidus externus, and this is called as globus pallidus internus. Next, down here we have got the thalamus. Below the thalamus, you have got the subthalamic region. Next, here you have got this thing called as internal capsule, and internal capsule is having three limbs. Anterior limb is present between the caudate nucleus and globus pallidus. Posterior limb is present between the caudate nucleus as well as the thalamus. And next, in the center, you have got what is called as a genu. Okay, genu or the leg, right? Next, between the globus pallidus as well as the claustrum, in between that you have got is a structure called as external capsule. So this is one way of classifying. This is one way of classifying what? One way of classifying the basal ganglia. Now, substantia nigra is present in the midbrain. I will draw the structure later on, but remaining all we have covered. Next, what is an other way of classification of these basal ganglia? What is other way? And by the way, remember, what are these ganglia over here? What is this in the center? What is this in the center? In the center, there is all white matter. But what are these nuclei? I told you, nuclei are nothing but pieces of gray matter that are embedded within the white matter is called as nuclei or the ganglia, right? So next important thing, coming to the second important classification over here. Now, the second important classification is that you can classify the basal ganglia. You can actually classify the basal ganglia into two different components. One is called as traditional components. Another one is called as clinical components. Okay, one is called as traditional components. Another one is called as clinical components. So what do you mean by traditional components and what do you mean by clinical components? So when it comes to the traditional components are divided into four: 1, 2, 3 as well as 4. What are these four? The first important traditional component is your lentiform nucleus. Okay. Next important traditional component is your claustrum. Third important one is your caudate nucleus. And fourth important one is amygdala, which is responsible for emotions, right? So amygdala. Now coming to this lentiform nucleus, you already know lentiform nucleus is divided into two important structures. What is the outer structure called as? Outer structure is called as putamen. Okay, and what is the inner structure called as? Inner structure is called as globus pallidus. So these are the things which you already know, right? So this is what is called as the traditional components. Now when it comes to the clinical components, how clinically you divide it? Clinical components. Now when it comes to the clinical components, we shall just write down the things which we did not discuss. So what are the three things that we did not discuss and we discussed in the previous classification? So the first thing goes here is substantia nigra. After the substantia nigra, you have beneath the thalamus, you have got subthalamic region. Within that subthalamic region, you have got a nucleus, and that nucleus is called as subthalamic nucleus. Okay, and after that, the last one is called as your thalamus. So these are the three important things. One is called substantia nigra, another one is called as subthalamic nucleus, and third important one is your thalamus. So this classification is called as the traditional classification as well as the clinical classification, where we divided into traditional components as well as the clinical components. Now, basically, what is the function of basal ganglia? What is the function of basal ganglia is that basal ganglia is the one which will plan the movements, right? It will plan the movements which are happening like flexion, extension and all. So it will plan the movements. Not only that, it will initiate the movements, and once after planning and all, it will take this information to the thalamus. From the thalamus, the information will go up to the cortex, and cortex will execute the actions. Okay. So what are the three important functions of basal ganglia? It will plan the movement. It will initiate the movement. Not only planning, you have to even initiate the movement, right? It will initiate the movement and it will transfer all these movements, whatever you have planned. All these movements are transferred to the thalamus. From the thalamus, they go to the cortex, and from the cortex, with the help of descending tracts, they will power up or they will contract your muscles so that the action will start. Even if you did not understand whatever I've told, just write it down. Later on with the pictures, I'll explain you what is actually happening here. Okay, so at the end you will completely understand. So basal ganglia has got these movements. It would plan the movement. The following functions are: it would plan the movement, and not only that, it would initiate the movement. And then it would transfer the movement. Transfer to whom? It would transfer to your thalamus. And what will thalamus do? Thalamus will transfer to the motor cortex, because from the motor cortex only the motor neurons will come down and contract your muscles, right? So motor cortex. And from the motor cortex, what is happening? The motor neurons are coming down and then they will execute the plan or execute the movements. So this is what is happening at the end. Okay, right. So this is the basic function of basal ganglia which you need to know, and I have to discuss it, so I have discussed it. Okay, so but in detailed we will discuss through the mechanisms. I will draw this nuclei, all these nuclei, whatever we discussed, I will draw them, and then I will draw the fibers and then explain you clearly there. Now this is the second classification. Now let us enter into the third classification. What is this third classification? In this third classification, the basal ganglia are just divided into three structures. Basal ganglia are just divided into three important components. What are these three important components? One is called as corpus striatum. Another one is called as just striatum or new striatum. Or simply called as striatum. And third one is called as paleostriatum. Now within this corpus striatum, there are two important things. What are those two important things? One is your putamen. Another one is your globus pallidus. Now within this neostriatum also there are two important things. One is again still it is called as putamen, and this time not globus pallidus, it is caudate nucleus. And finally the paleostriatum has only one thing, that is globus pallidus, right? So even if it is difficult for you to understand this way, so I'll just draw a picture so that it would be clear. Let us say this is your lentiform nucleus. Lentiform nucleus is having two important parts, right? So this part which I have highlighted at the back, this part is called as your putamen. All of you know this. And after that, let us say if I'm dividing this, the next part is called as your globus pallidus. And globus pallidus is divided into two important components, right? One is called as globus pallidus externus. Another one is called as your globus pallidus internus. So let us together write it down as globus pallidus. Okay. Next, above here you have got a nucleus, and this nucleus over here is called as your caudate nucleus. Let us say this is your caudate nucleus. Let me write it down. So this part is your caudate nucleus. Okay, and this part over here is called as your putamen. This is your putamen, and this part over here is called as your globus pallidus. Now what I'm telling you is that let us say what is paleostriatum? Only the globus pallidus. You see this? Only this globus pallidus is called as your paleostriatum. Now, what is new striatum? Putamen and caudate nucleus. You see, this is your putamen and this is your caudate nucleus, which means this particular structure over here, right? So this particular structure over here is what is called as your new striatum. And what is corpus striatum? Putamen and globus pallidus is called as your corpus striatum. Okay. See, this is putamen and this is globus pallidus. See this entire part. Okay, this entire part over here is what is called as your corpus striatum. So even if you remember with the help of the picture, that will be well and good. Okay, so these are the three important structures. These are the three important classifications. So once again, let us just revise these classifications fast before we proceed on to the next one. So basically there are three important types of classifications of basal ganglia. So what is this classifications? In the first classification, basal ganglia is divided into corpus striatum, claustrum, substantia nigra in the sense black substance, and next subthalamus, which is located beneath the thalamus. So corpus striatum has got lentiform nucleus and caudate nucleus. Lentiform nucleus intern has got outer side is called as putamen and inner side is called as globus pallidus. And again, this globus pallidus is divided into globus pallidus externus, globus pallidus internus. Next, thalamic subthalamic region. So here you can see very clearly that this green color thing over here is called as your caudate nucleus. The pink one is called as your thalamus. Okay, and this red one over here is called as your lentiform nucleus, which is divided into two. So this part is called as a putamen and the rest of the part is called as a globus pallidus. In this globus pallidus also globus pallidus externus is there, and next is globus pallidus internus is there. Okay, next this part over here is called as your claustrum. Between the claustrum as well as this lentiform nucleus, you have got this structure. This piece of gray matter over here is what is called as your external capsule. In the front, you have got this called as internal capsule. Okay. So next important classification is, it is divided into one is called as traditional components, another one is called as clinical components. Traditional components, again the same, but one thing is different. Lentiform nucleus, claustrum, caudate nucleus are same. Amygdala is a new one. Okay. So you know this thing, clinical components, substantia nigra, subthalamic nucleus, as well as thalamus. Thalamus, beneath the thalamus, you have got subthalamic nucleus. So coming to this third type of classification, here putamen and globus pallidus, right? Putamen and globus pallidus together you call it as corpus striatum. Second important thing is globus pallidus, right? Globus pallidus, only it is called as alone, it is called as paleostriatum, and putamen and caudate nucleus is called as neostriatum. Now what we shall do is that we shall discuss the pathways of the basal ganglia. Within this basal, how does this basal ganglia, this nuclei and all, how do they work? How are they associated with each other? So those things we'll discuss now. Now, within this basal ganglia pathway, there are three different types of pathways. One is called as a direct pathway, another one is called as an indirect pathway, and the third one is called as nigrostriatal pathway. The pathway that is starting from the substantia nigra, right? So there I will discuss where is substantia nigra and all. So three pathways. One is called as your direct pathway, second is called as indirect pathway, and third one is called as nigrostriatal pathway. So this basal ganglia pathways, we will discuss about basal ganglia pathways. So what are the three pathways we have got? We have got 1, we have got 2, and we have got 3. What are the three pathways we have got here? Once again, one is we have got the direct pathway. Okay. Next we have got is the indirect pathway. Okay. Third one is we have got the nigrostriatal pathway. Nigrostriatal pathway. So first of all, let us see what is the direct pathway. So first important thing before I discuss the direct pathway is, let me draw the cerebral cortex over here. So let us say that this particular thing is your cerebral cortex. Right. So this particular thing is your cerebral cortex. Now within this cerebral cortex, you see these are all gyri and sulci which I have drawn over here. Okay, so all these are your gyri as well as sulci over here. Now, important thing you need to understand over here. What is this important thing is that here, exactly here, you have got this particular, whenever I'm drawing such nucleus, you need to understand that this is your lentiform nucleus. Now, this lentiform nucleus has got two parts. Again, I'm telling you. So, what is this part over here? This part over here is called as a putamen. Putamen is a part that is present outside. And next important thing is that you should also know that inner part is called as your globus pallidus. Within this globus pallidus, again, there are two parts. This is globus pallidus externus and internus. So let me write it down. This is your putamen. This is globus pallidus externus, and this is globus pallidus internus. Globus pallidus externus and internus. Next important thing is that this particular thing you can see over here, this is called as your thalamus. Okay, this is called as your thalamus. Now, first important thing, what is going to happen? What is going to happen is that there are a group of nerve fibers, there are a group of neurons that will come all the way from the cortex. They start from the cortex, and what is the function of this, I will tell you. Okay, just be patient with whatever I'm telling you. So from the cortex, it will start all the way down and it is going to enter into your putamen. Okay, now these bundle of fibers, I've drawn just only one fiber, but there are bundle of fibers like this. So these bundle of fibers which are starting from the cortex going down is called as corticostriate pathway. Okay, so what is this pathway over here called as? This is called as corticostriate pathway. This is called as corticostriate pathway. And what this corticostriate pathway will do? This corticostriate pathway is relying on one nucleus. And this nucleus has got an axon that goes all the way and enters into where? Globus pallidus externus or internus. It is entering into globus pallidus internus. And from here you have got a third order neuron. First order neuron is this, and this is the second order neuron. Now the third order neuron. Third order neuron starts from the globus pallidus internus and goes all the way into your thalamus. And by the way, this part is your thalamus. This is your thalamus. Okay, right. Now, if I write it down, that this is A, corticostriate pathway, and this is B over here, and this is C over here. What is this B called as? This B is called as striatopallidal pathway. Why pallidal? Because at the end it is entering into the globus pallidus. So pallidal pathway. Why you are calling it as striato? Because this is corpus striatum. So this B is called as striato pallidal pathway. Okay, striatopallidal pathway. Next, after the B, the C. What is this C called as? C goes all the way from the globus pallidus internus to the thalamus. So you can call it as pallidothalamic pathway. So C is called as pallidothalamic fibers or the pathway. Thalamic fibers or the pathway over here. Okay. After that, from the thalamus, you see another nucleus that is starting here. This nucleus from here, another group of fibers go into the cerebral cortex like this, right? So these group, let me write this down as D. And what is D over here called as? From the thalamus, it is going to the cortex. So thalamocortical pathway or thalamocortical fibers. Thalamocortical fibers. Now, what is happening once it enters into the thalamocortical fibers? So, where it is actually going to enter? It is actually going to enter into your motor cortex. Motor cortex. Now, you will understand completely what I am trying to tell you. So, what I am trying to tell you over here is that let us say that this particular thing is your cortex, and this is your midbrain over here. This is your pons. This is your medulla oblongata like this. Clear? Now, where is your thalamus? Somewhere here. Let us say this is your thalamus. Okay. Now, fibers, you know one thing, that fibers from the thalamus, you see, fibers from the thalamus are entering into the motor cortex. Now, in the motor cortex, there are neurons. So, this was the thing I have shown, right? See, fibers from the thalamus like this are entering into the cortex. So, this is the picture, thalamus to the cortex. And this cortex I told you is the motor cortex. Now, exactly in the motor cortex, you have got one more neuron. Okay. Now, look what is happening with this neuron. This neuron takes the information whatever is given by the thalamus, and this neuron descends down all the way like this. Okay. Now, where it is descending? It is descending down into your spinal cord. Once it descends down into the spinal cord, within the spinal cord, another neuron starts, and this neuron all the way goes and innervates or supplies to your what? It innervates or supplies to your skeletal muscle. And once it supplies to your skeletal muscle, there is contraction. Now look what is happening. You remember that in the starting I told you here that basal ganglia will plan the movement, right? So it has planned the movement. After that, it initiate the movement. It will transfer the movement. All this planning, whatever is there, it will transfer to the thalamus, and thalamus will transfer to the motor cortex. See here what has happened. So whatever plan has made, finally it entered into the thalamocortical fibers, and from thalamocortical fibers, the plan has entered into the motor cortex. And in the motor cortex, what has happened? This plan is transferred to other neurons here, right? So these neurons over here are called as upper motor neurons. Upper motor neurons. So upper motor neurons are descending down or ascending up? They are descending down. That is why these are called as descending tracts. Descending tracts. So if you want me to name this tract, just look from where till where this tract is coming. This tract started in the cerebral cortex and coming to the spinal cord. So can I write it as corticospinal tract? So this tract is called as corticospinal tract. And next, what are these neurons that are going away from the spinal cord and entering into your muscles? These are called as lower motor neurons. Okay, these are called as lower motor, and lower motor neurons are the one which will execute the contraction. So this is what is happening in a pathway, and this pathway, whatever I have told you, is called as a direct pathway. I have just told you the structure of the direct pathway. I did not tell you the function of the direct pathway. I will tell you the function after explaining the indirect pathway. Okay. So in this direct pathway, from the cortex till the putamen, this is called as corticostriate, right? From the putamen to the globus pallidus internus, not externus, internus, this is called as striatopallidal pathway. From the internus to the thalamus, this is called as pallidothalamic pathway. From the thalamus to the cortex is called as thalamocortical pathway. Okay. Now what we will do is that this pathway, whatever I've explained you, is called as the direct pathway. Okay. Now after this direct pathway, the next pathway which we shall be discussing right now will be the indirect pathway. Now what do you mean by indirect pathway? Just look at the picture. So let us say that this particular thing over here is your cerebral cortex. Right? So this particular thing over here is your cerebral cortex like this. Yeah, this is your cerebral cortex. Now down here if you see, the pictures don't change here. The same things over here. Here we have got our globus pallidus. You remember, right? We have got the lentiform nucleus. Now this lentiform nucleus is having this structure which is present outside. What is this? This one you called it as what? This one you called it as putamen. After the putamen, the structure that is present inside is called as globus pallidus. And what did I tell you? That globus pallidus, you can divide this globus pallidus into two parts. One is called as globus pallidus externus and internus. After that, we have also discussed that here we have got a structure, and this structure over here, I called it as thalamus. Thalamus. And tell me, any nucleus that is present beneath the thalamus, what should I call? Should I call it as subthalamus? Right? So let us say that this particular structure is called as subthalamic nucleus. Subthalamic nucleus. Okay. Now, let us look at the pathway. Now, how does a pathway look? First important thing is that, let me write down these things also, that this is your putamen, globus pallidus externus, globus pallidus internus. Okay. Now look here. So first it starts from the cerebral cortex. The neuron starts from the cerebral cortex. From there, this bundle of nerve fibers, they come and they first enter into your putamen. Clear? Now, obviously, you know this. What is this? Cortex to putamen. Corticostriatal pathway. So, this pathway over here, I am writing it as A. Later on, I will write down all of this. A is called as corticostriate pathway. Now, within the putamen itself, you have got a second neuron like this. You have got a second neuron, and this second neuron is extending till globus pallidus externus. Okay. It is extending till globus pallidus externus. And from globus pallidus externus, you have got a third neuron. And this third neuron is not entering into globus pallidus internus. Rather, this third neuron is right now entering into where? It is entering into subthalamic nuclei. From the subthalamic nuclei, you have got the fourth neuron. Now, this will enter into your globus pallidus internus. From globus pallidus internus, you have got a fifth neuron. This will go and enter into your thalamus, and from the thalamus, the final neuron will go and enter into your motor cortex, and again the same, from the motor cortex with the help of descending tracts, it will come down. Now here, look how many pathways are there. This is A, one pathway, right? Next here you have got as B, and here you have got C, and here you have got D, E, as well as F. You see how many pathways are located over here? Clear, all of you? Now, here the pathway, by looking at this picture itself, you can very clearly understand that this pathway is not a direct pathway. This pathway is an indirect pathway. Now, after discussing the direct and indirect pathways, now let us see what is the real concept behind this. Why are we discussing this direct and indirect? What is the use? Now we will put the direct and indirect together, and then we shall discuss the structures, discuss the function of this. Okay, right. So let me draw the picture here. Let us say that this particular structure over here is your cortex. This is your cortex. Now down to the cortex over here, you have got this structure like this. What is this structure? This is globus pallidus in the front, and on the back here you have got putamen, and this is globus pallidus externus, globus pallidus internus. Okay. Anyways, I won't write it as globus pallidus externus and internus now, because you already know it. And this is your thalamus, and also I should also include subthalamic nuclei. Clear? So now what we will do is that we will discuss the direct and the indirect pathway, and this pathway over here which we discussed is your indirect pathway. Now we will understand what is the concept behind this indirect and direct pathway. So first what I will do is that I will draw the direct pathway, and then I will draw the indirect pathway. So from the cortex, right, directly from the cortex. Okay, let me put this a little bit forward in the front. Yeah. So from the cortex, what is happening? First, you see a neuron that is coming all the way down. You see a neuron that is coming all the way down to where? It is coming all the way down into your putamen. Okay. Now, after when it comes to the putamen, within the putamen itself, you have got another neuron that goes all the way and enters into your globus pallidus internus. From the globus pallidus internus, you have got a third neuron that is going all the way and entering into your thalamus. And from the thalamus, you have got another neuron that is going all the way up into your motor cortex. So this pathway, whatever I've just now discussed, is direct pathway. Now coming to the indirect pathway. Indirect pathway is, it starts all the way in the cortex, right? It is coming down all the way into your putamen like this. Now within the putamen, you have got another neuron. Now this neuron all the way goes into your globus pallidus externus. From the globus pallidus externus all the way down into your subthalamic nuclei. From the subthalamic nuclei all the way up where? Into your globus pallidus internus. From the globus pallidus internus all the way up into your thalamus, and finally from the thalamus up here. Okay. Now you should know the nature of these neurons. What do you mean by nature of these neurons is that you have got two important neurotransmitters here. One is called as GABA, another one is called as glutamate. Glutamate is an excitatory neurotransmitter, which means it will excite the things. GABA is an inhibitory neurotransmitter, which it will inhibit the neurons. Glutamate will activate the neurons, whereas GABA will inhibit the neurons. For example, see this neuron, the first order neuron here in the thalamo. What is this? This is your corticostriatal pathway. This releases glutamate. GLU. Okay, I'll write it as complete name, glutamate. Even this green one also releases glutamate. It means when it is releasing glutamate, it means these have a capacity to activate other neurons or inhibit other neurons. They have a capacity to activate other neurons. Now, after that, you see the second neuron over here. This second neuron releases GABA. And next, the third blue neuron also releases GABA. Okay. Next, the next neuron over here, again it releases, this one releases glutamate, GLU, glutamate. Okay. Now, look at the next one. What does this neuron over release here? This releases GABA. This releases GABA over here, right? And after that, the next neuron also releases GABA. See, this one also releases GABA. And after that, this one releases glutamate over here. And again, this releases GABA, right? So once if you practice, it would be easy. Now it might look a little bit difficult, but it will be easy. And this releases glutamate. Now let us start discussing the pathways. Now, why do we need these pathways? So this is your direct pathway. This is your indirect pathway. Why do we need this is that, see, normally if I wanted to flex my arm, right? If I wanted to flex my elbow. Now, when I'm flexing my elbow, it means all the muscles which are located over here are called as my flexors. All the muscles which are located on the back are called extensors. If I have to flex my elbow, this is how I flex my elbow. Yes or no? So, when I'm flexing my elbow, it means all my flexors are contracted or relaxed. All my flexors are contracted, right? Now, when I'm flexing like this, all my extensors are contracted or relaxed. All my extensors are in a relaxed position. Clear? When I'm extending, all my extensors are contracted and all my flexors are relaxed. You see, vice versa is happening. Both flexors and extensors cannot contract at the same time. When you are contracting your flexors, extensors have to be relaxed. When you are contracting your extensors, flexors have to be relaxed. Now, how is this work simultaneously happening in the body? It is mainly happening because of this basal ganglia over here. Let us say I wanted to contract. That thought came in my cerebral hemisphere. Now, when that thought came in my cerebral hemisphere, just look whatever I'm telling. So, direct pathway will be activated. If I wanted to contract, direct pathway will be activated. Now, when direct pathway will be activated, this neuron is activated. This neuron will release what? Glutamate. Just look here. You see, this neuron is releasing glutamate. Okay. So, let me write it as G. You see, this neuron releases these dots, whatever I'm putting down here. This neuron releases what? Glutamate. Okay. What does this glutamate do? What did I tell you? That this glutamate will activate, right? So what did I tell you? That this glutamate will activate the second neuron. Now, what is the second neuron it is activating? This is called as a GABAergic neuron because it is going to release GABA. So this neuron gets activated, it releases glutamate. So these neurons are called as glutanergic neurons because they release glutamate. So glutanergic neurons will activate a GABAergic neuron, and this GABA is released over here. You see, GABA is released. And tell me, GABA will inhibit a neuron or activate a neuron? It will inhibit. So if this second neuron is releasing GABA, this second neuron will inhibit the third neuron. It means this neuron is also a GABAergic neuron, but this GABAergic neuron right now is inhibited. So if this GABAergic neuron is inhibited, what will happen? Do you think this GABAergic neuron is going to release any kind of neurotransmitter? No. If it is not going to release any kind of neurotransmitter, then what is happening? This neuron, this particular neuron, is it under an activity of any inhibition right now? No. There is no one to inhibit this. If then there is no one to inhibit this, then this neuron is activated. Now, this is the part you are getting confused. You are thinking, who is activating this neuron then? This neuron is 24/7 under active state. Remember this thing. Okay. See, this particular neuron, let us say 1. Okay. Let us say 2. Let us say 3. Let us say 4. Okay. The neuron number 4 is 24/7 activated. 24/7 it keeps on releasing what? Glutamate. But every time releasing glutamate is not good. So I have to restrict the movement of releasing glutamate. For that reason, behind that I have kept neuron number 3. This neuron number 3 releases GABA and all the time it inhibits this fourth neuron and keeps it there. Okay. For example, if I wanted to contract, when I wanted to contract, first neuron number 1 is activated. Neuron number 1 will release what? Glutamate here. This glutamate will activate, plus sign I am putting, which means activate. It will activate GABA neuron, and GABA neuron releases what? GABA. You see, it releases GABA, and GABA inhibits or activates, it will inhibit third neuron. If third neuron is inhibited, then is fourth neuron under any activity of inhibition here? No. So fourth neuron automatically it is firing, right? So when it is firing, what is happening? Your cortex is activated. This cortex will send the impulses down and then you will flex your arm. This is what is happening. Now opposite of this is what? You have to relax your extensors. So immediately your indirect pathway is also parallelly starting. What is happening? To relax your extensors, your indirect pathway, in your indirect pathway also, let me name the neurons as 1, 2, 3, 4, 5 as well as 6. Okay. In your indirect pathway, what is happening? In the indirect pathway, first glutamate, this glutanergic neuron is activated. If this is activated, this will release what? Glutamen here. And this glutamen will activate your GABA. Right? So obviously the neuron number 2 is also activated. And this neuron number 2, what it is doing? This neuron number 2 will release GABA. Now GABA will inhibit the third neuron or it will activate the third neuron? It will inhibit the third neuron. If third neuron is inhibited, do you think third neuron will release GABA? No. If third neuron is not releasing GABA, then what is happening? What is happening is that this fourth neuron, right? Fourth neuron, is it under any activity of inhibition? No. So fourth neuron continuously keeps on fires. Then these days, why you did not fire? Because these days behind me, neuron number 3 GABA was there. It was not letting me fire. Now GABA is dead. Neuron number 3 is gone. So now I can happily fire. And glutamate starts firing, and this glutamate starts activating your neuron number 5. Now once neuron number 5 is activated, what will happen? This neuron number 5 releases GABA. And this GABA will activate neuron number 6 or inhibit? Inhibit. When it will inhibit, do you think neuron number 6 will fire? No. So when neuron number 6 is not fired, what will happen? The muscles are all paralyzed here. Right? So you see the differences here. In one direct pathway, you see activation of flexors. At the same time, there is inactivation of extensors also. Okay. So I hope this explanation finds it easy for you, right? I hope this explanation is a little bit easy for you. I hope you will understand whatever I have told you here, right? Now, the last important thing is that we have also discussed the third important pathway over here, that is nigrostriatal pathway. What is this nigrostriatal pathway? Nigrostriatal pathway in the sense, within the midbrain, you have got a structure called as substantia nigra. So from the substantia nigra, the neurons which are coming out are called as dopaminergic neurons. Why? Because they release a thing called as dopamine. Okay. Now just look at these neurons over here. What is happening? Let us say that this particular structure, whatever I am drawing right now here, right? So yeah, see this particular structure, whatever I'm highlighting over here, is your black substance, or also called as your dopamine. So this substance over here is called as the black substance. Okay. Now within the substantia nigra, the entire substance is not black. You can see here, this upper part is completely dark and the lower part is light, right? Why upper part is completely dark? Because it is having a lot of black cells, right? Why the lower part is light? Because it is having few black cells. So that is why upper part is called as pars compacta. Pars compacta, and lower part is called as pars reticularis. Pars reticularis. Whatever it is, from here, you see one neuron. Okay, let me just clear this off so that it would be easy for you to understand. Right. Now all of you just look here. From this pars compacta, you see a neuron that is going up and it is activating your neuron number 2 in the direct pathway. And next, another neuron also that is going up and activating your neuron number 2 in the green color pathway. Now, what is happening here? Neuron number 1 and neuron number 2, both of them are releasing GABA. Both of them are releasing what? Dopamine. Both of them release dopamine, but the actions will be different. When both of them are releasing dopamine, still the actions are different. What are these actions? Look here. If you very closely look here, right? So this neuron number 2, you see, this neuron number 2 is having a small receptor on its surface. In the same way, this green color neuron over here is also having a small receptor here. Okay. So what is this receptor which is located here? This receptor over here, right? This receptor over here is called as D1 receptor. And this receptor over here is called as D2 receptor. Okay. So you see, there is a receptor here. This receptor is called D2 receptor. D1 receptor is an activatory receptor. D2 receptor is an inhibitory receptor. What do I mean by that? What do I mean by that is that same like other neurons, even these dopaminergic neurons also do the same function. For example, uh, from the black substance, right? From the black substance to the this part, right? The putamen and all, whatever neurons are going here, this is called as nigro. Nigro means black, and this is called as striatum. And these fibers are called as nigrostriatal pathway. So when these two neurons are activated, when these two pathways are activated, look what is going to happen. What is going to happen is that first here it will release dopamine. You see all these green dots. Okay, let me put it with red. You see all these red dots here. Dopamine is released, and this dopamine is acting on where? See, it is exactly acting on this D1. When it will act on this D1, D1 is an activatory receptor. It means it will activate this GABA. So once this activate this GABA or neuron number 2, what will happen? This will start releasing GABA. And this GABA will inhibit the next neuron, that is neuron number 3. So obviously GABA is inhibited. So when GABA is inhibited, do you think this neuron number 4 is under any inhibitory activity now? No, because GABA is inhibited. So obviously what will happen? The neuron number 4 will start to fire because it is having glutamate, and obviously there will be contraction. This will also do the same function only. But it is doing the same function like contraction through a different pathway, that is through the nigrostriatal pathway. Okay. Now go to the neuron number 2. This neuron number 2 also releases what? Dopamine over here. But this dopamine is falling on which receptor? It is falling on D2 receptor. Okay. So when it falls on this D2 receptor is an inhibitory receptor. This neuron number 2, right? This neuron number 2 is inhibited. Once this neuron number 2 is inhibited, now do you think neuron number 3 is under any inhibitory control right now? No, because neuron number 2 is not working. So then what will happen? This GABA neuron is not under any inhibition. So this GABA neuron will very happily keep on firing. So when it keeps on firing, you don't know one thing, that this is a GABA neuron. So this GABA neuron will inhibit the fourth neuron here. So once it will inhibit the fourth neuron is what? Glutamate. So if fourth neuron is inhibited, do you think fourth neuron can activate fifth neuron? No. Fourth neuron, if it is inhibited, how do you think it will activate fifth neuron? It cannot activate fifth neuron. So when fifth neuron is not activated, do you think fifth neuron will release GABA here? No. So when fifth neuron will not release GABA, do you think neuron number 6 is under any inhibitory action now? No. So obviously neuron number 6 also will start to fire, and that will also lead to the contraction. Okay. So this kind of pathway, it might be a little bit tricky, but it is a very easy pathway. If you just follow the things which I have told you slowly here, just glutamate is activatory, GABA is inhibitory. This is the only rule which you have to know, right? If you follow this, then this would be easy. Okay. This pathway, whatever we have discussed over here, is called as nigrostriatal pathway. So this one over here is called as your nigrostriatal pathway. So this pathway over here is called as your nigrostriatal pathway. So let us just have a quick recap of what are the direct pathway and indirect pathway differences. Direct and indirect pathway differences. Direct pathway, if you look at the picture, direct pathway is short or indirect pathway is short. Obviously, direct pathway is the short length pathway, and indirect pathway is a longer length pathway. Okay. Next, direct pathway is a stimulatory pathway. Whereas indirect pathway is an inhibitory pathway. Okay. Now, direct pathway will stimulate, in the sense, stimulate what? Stimulate your upper motor neuron as well as the lower motor neuron. Okay. Inhibitory pathway will inhibit what? Your upper motor neuron as well as your lower motor neuron. If upper motor neuron and lower motor neuron, both of them are activated, this would lead to what? Muscle contraction or muscle relaxation. This would lead to muscle contraction. Next, upper motor neuron and lower motor neuron inhibition will lead to what? This would lead to muscle relaxation. Muscle relaxation. Okay, so these are some of the very important pathways which you need to know, guys. So this is all you need to know regarding the basal ganglia. Thank you so much for watching my video. Goodbye.